Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I'm going to talk to you a little bit about missing permanent teeth in early cases where instead of filling in with implants or bridges or anything, we try to move some of them. We would close the back teeth, we would close the spaces by bringing the back teeth forward. We used reverse headgear back then. That was before we had tads to hold the teeth down, so you might could just put tads in them now and bring the teeth from the back to the front and not have the front teeth go back. So we explained that to this young lady, a very charming young lady, and we enjoyed working on her. She was just full of life. Now she had a peg lateral in one of her upper lateral teeth right here. Let me get my little marker going here, and I can show it to you. This is a lateral tooth there. It's a peg lateral, and on the other side she was missing the lateral. So we had to go in and decide if she was missing one. We had no teeth to fill that because we were missing the second bicuspid on those sides. So we had to put a bridge in where it swung off of the cuspid tooth to fill that gap. We'll show that later. Now these were deciduous teeth here. There's missing permanent teeth underneath them, and we'll show that on the x-ray again in a little bit. Again, the upper second molars were just gone all the way around the mouth. And you don't want to wait till the person gets grown to do this. You start early and do it. So we took the deciduous teeth out. Here's a little peg lateral right here. We'll open up the space and band that and widen it out. Then we can crown it with a normal size tooth. And then on the other side where the tooth was missing, we actually slid this cuspid back, and we had the bicuspid was missing up here. Move this back and put a bridge on that side. Or I didn't do that, but some or other dentists did that. Now, in this area right here now we're missing, we took the deciduous molars out, and we're going to try to bring these teeth forward from the back. And then we use our wisdom teeth to fill in behind that. And so we slide these forward, and we use a reverse headgear called a Hickam chin cup type birthday. And you put the chin cup back here, and you've got a wire running around here, and then they can flip their hair forward and bring it back, and you'll really even see this. And we'll pull these back teeth forward by pushing back on the chin. Now this is from the front looking at it, and you got to fix this where you're pulling your elastics through right where the lips come together. Don't be trying to pull it through too low or too high, but see right where the lips come together. That's where you want the elastics going back to the back to pull the back teeth forward. So here we're opening the space for this crown on this tooth. We open this space and we put a false tooth in here, and we're going to put a bridge in that area, kind of a cantilever bridge. It works off of that. You can do it, or you can have somebody else do it. It seemed like we probably did this. This was back in '71, I think, when we started this case. Now this is a false tooth. We banded it, and we didn't have bonding brackets or anything, but there's no root on this. Is just a tooth setting up there on the arch to hold the space open. So here is this tooth we added here while we did the case. We banded. We made a band to go around this tooth. We didn't have bonded brackets or anything, and I opened the space so we could crown this tooth right here and make it a normal size tooth. And we closed the space and brought these teeth forward with that reverse headgear. And so these are the 6-year molars, but there's no second bicuspids. We close that gap up right there. Now that's doing a Hickam chin cup, and we put this elastic right where the teeth come together. Don't put it up where you have to raise or lower the lip. You run that back in there. Here we're opening this gap. We're going to crown that tooth, and we're going to put a bridge in on this side over here. Now here we're starting out to look at, you can see the x-ray. This was 1971. Some of these people watching this won't have been born then. But this was the cutting edge of dentistry back. And this, bringing these teeth together to close this. In other words, we're using orthodontics to do restorative dentistry. And that's what I'm trying to get across. We ought to be restoring anybody that's missing teeth in here. If you've got a wisdom teeth back here that you're going to throw away, move them up and close the space. That's what we're after, to get people to use the natural teeth. You can move these molars up and close up those spaces. And we've done this on adults and everybody. This is a young girl. She's age 12 years old here at this point. So we're going to take this away, take this out right here. And now we're going to bring this over. We got to do some fillings and some teeth on this. And we'll bring this up and close that space. Then this tooth will come in behind, and we'll move it up too. So you can just move all these teeth. And we did it with reverse headgear, pulling from that. Nowadays, you could put a tad in here and stop this tooth from going back and just pull against this, and you wouldn't have to use much headgear as far as that goes. You can put these little screws in the bone, put it in the cortical bone, and bond it to the teeth. Now, these two teeth, we're going to move forward. These two teeth, we move and close that space, and you watch that happen. And now, before we got that all the way up, we move this back, and we got that tooth open, that space open. So we open the space between the cuspid and the central, and we'll put a cantilever bridge on that. And over here, we'll crown that little peg lateral right here. We'll crown it. All right, now these teeth have been moved forward by using this reverse headgear. And that is still a good piece of equipment for doing orthodontics. Now we crown the cuspid and put a cantilever bridge on it and put a lateral swinging off of this heavy cuspid. And over here we just crown this tooth right here and fill that gap with a tooth the same size of that. And here she had to have a root canal done on the tooth like that. We had some pretty bad cavities that we had to fill on the teeth too. Now here is the thing. This is 1971. This is 12 years old, and all this is taking place. And this is a neat kid, and we were able to go in and pull this up and finish her up, and she looked like she had just a full set of teeth and let her spend her life. And as far as I was concerned, this stayed with her as long as we knew this young lady, and she stayed around for several years. Thank you for watching, and I'm going to close out now. And this is something that we do for pediatric dentistry. You can do that, and I think the pediatric dentists and dentists working with children should be able to do this type of orthodontic work now. So I'm going to close out and say goodbye.